It's a new year, and maybe your New Year's resolution is to finally stop being so stiff, improve your mobility, and feel better. And I bet any money that involves you trying a bunch of different exercises on YouTube channels like myself or others, trying to get some relief. But what I don't want you to do is to make these 5 common mistakes that I see people do during mobility drills. And these are mistakes that I had made in the past with my patients and clients. And with experience and age, I've tweaked these things, and it has led to better changes in range of motion for the people I work with. I want to save you time so that way you avoid the same mistakes that I made. Number 1 is tucking the hips. In a lot of my older videos, I spent a ton of time coaching the tuck, and my goal was to improve hip mobility, especially in those individuals who have a deep arch in their back. But then I ran into some problems. I had some people who didn't have a deep arch. They had more of a sway back posture. Or I would have people tuck the hips under load, and that would either put too much load on the back or create a lot of stretching in that area. And I wasn't getting as good of mobility improvements in those folks as I should have. And the reason why is because when you tuck the hips, it's very difficult to differentiate pelvic movement from spinal motion, especially if you're restricted. So I've completely abandoned hip tucking. Instead, what I coach now is contacting the ground in a certain way. This ground contact promotes muscle activation in areas that can improve hip mobility. It creates internal rotation, which is necessary for force production. If I create internal rotation in a point that's in an arm or my leg, it allows for expansion in the more spinal segments of my body. Having these alternating actions is the real way to maximize joint mobility. Think of it like this stress ball. If I squeeze the stress ball, you'll notice the beads move away from where I squeezed. My hand, in this case, is the ground contact. It is the internal rotation. Where the beads are is the opposite area that expands. So this could be your pelvis. This could be your rib cage. We want this alternating action if we really want to gain motion. You don't get that when you tuck the hips. Number 2 is shifting the hips. Hip shifting is when you try to theoretically pull one hip into the socket, or you try to create some relative motion through the pelvis before going into a movement. It's something I used to do quite a bit to try and improve rotation in my patients and clients, but there's one big problem with it. And that problem is just orienting the entire body as opposed to restoring relative or segmental motion at the respective joints. Relative motion is when I can move segments independently of one another. But with things like hip shifting, that's not always the case, because oftentimes you are quite restricted in the direction that you're trying to shift. And you have to ask, how are you going to get there? Well, if I don't have that motion, and I've seen this with a lot of people, is I might end up creating the motion through the spine as opposed to segmentally through the pelvis. This is especially true in loaded exercises. In things like a split squat, sometimes people will coach shifting the hips and then descending into the squat. But the problem is you no longer have range of motion available to produce the internal rotation needed to hit depth. Just like you don't elevate your shoulder blade before you raise your arm overhead, you shouldn't shift your hips before you do something like a split squat or a lateral lunge. Now, that doesn't mean that the pelvis and the spine shouldn't move whatsoever. What should happen is this axial skeleton motion should occur gradually as opposed to immediately. So if you're doing a split squat, instead of shifting the hip and then going down, you should see this gradual rotation occur as you descend into the motion. If you emphasize that, you're going to get far better mobility improvements than you did with shifting the hips. And the other thing is, hip shifting is really complicated for most people. The overwhelming majority of folks that I've worked with do much better by emphasizing ground contact and nailing the breathing, which segues into the next 2, which involve breathing. The first is taking too big of an inhale. If you're trying to gain motion, You need to expand or create more space in a given area. Every time you breathe in, your body theoretically expands to make more room for air. When that expansion occurs, there's an absence of muscle tension and activity. When that happens, it allows for segmental mobility of the rib cage as well as the pelvis. But if you're taking a big, massive inhale, that isn't happening. When you take a big inhale, your neck muscles will kick in. You can see when I inhale forcefully, my neck engages. This neck tension restricts the upper airway and limits your ability to expand. Under normal circumstances, the only neck muscles that will kick in when you breathe are the scalenes, and it's a slight amount. These muscles will work during tidal volume, which is the amount of air that's pulled into your lungs during a normal breath. But if you take a breath in beyond that tidal volume, your neck muscles will kick in to elevate the rib cage, which fills the bottom aspect of the lungs, allowing the lungs to fill as much as possible. But when the lungs fill like this, you don't have segmental ribcage motion. You have all of the accessory muscles kicking in as a unit to pull as much air in as humanly possible. And these bigger muscles reduce the segmental ribcage motion. That's going to limit your mobility. So when you are breathing in during mobility exercises, you want to keep your tongue on the roof of your mouth, your lips comfortably closed, and have a quiet, silent nasal inhale. Pretend that Michael Myers from the Halloween movies is close by, but you have to do these exercises. If you do that, you're going to encourage that segmental ribcage motion. It'll make the expansion more uniform, and most importantly, it'll improve your mobility. The next piece is stop forcing a full exhale. And it has similar problems that we had with the big inhale. When I force an exhale, instead of having segmental closure of the ribs, the big muscles, such as the superficial abdominal muscles, especially rectus, damn near cildus abdominis, end up pulling the rib cage down as a unit, as opposed to compressing all of the air out of the lungs. I see this especially when people force the rib cage down during an exhale. The problem with this is it actually limits the subsequent inhale. If the inhale is restricted, you can't expand and you're not going to gain as much motion as you could. During an inhale, you end up doing that quick reflexive, or you do the sniffing dog trick where you sound like, chances are you exhaled too fully, you got all the air out, and it restricted your ability to inhale and expand. When it comes to gaining motion, we want to limit superficial muscle activity. Making your exhale chill, easy, and not all the way out is a way of helping facilitate that action. I've made this shift with all of my patients and clients, and I've seen much greater mobility improvements by dialing down the effort required during mobility and breathing drills. And last, but certainly not least, is reaching too far. If you are someone who reaches to end range during any of your mobility drills, you're probably not gaining as much motion as you could. And that's for two reasons. The first reason is anytime you reach your arm to end range, there's more tension produced in the body. Just like if I were to stretch my arm fully overhead, I feel tension in the lats. Same thing here. If I reach my arm fully, you'll get tension in the upper back, and that's noticed especially during the inhale. If you're trying to gain mobility, you want as little tension as possible within your body. Less tension means more capability to expand. The second reason is because when you reach to end range, more often than not, the thorax will come along for the ride and orient. We saw this when we exhaled forcefully and how that caused the ribs to come forward. The same thing can happen with too big of a reach. You might see someone crunch, they might end up arching their back, or they might twist and rotate in an undesirable manner. If you do these things, you're not going to gain as much mobility as you would otherwise. What should you do instead? It depends on the exercise in question. If my arm is in the air, I will just hold the position and breathe using the same strategies we talked about previously. If I'm supporting myself on the ground, I will make sure I get good ground contact like I talked about with the tucking portion. So make sure you stay heavy on the contact points that you want. Oftentimes in the hand, it's the pisiform or the wiggle bone of the wrist, as well as the base of the index finger. And you want to slowly push yourself away from those points to about a 3 to 4 out of 10 effort. And the one time that I will reach beyond this middle range is if it's a dynamic exercise. Usually in that case, I will pace the reach with the exhale during the concentric or shortening phase. And then I will also pace the eccentric phase with the subsequent inhale. The basic summary with all of these tweaks is you need to dial down the intensity of your mobility drills. Mobility drills are supposed to be easy, effortless, and more flowy, because when things are easy, there's less tension being produced. And when there's less tension being produced, you can have more movement freedom. Now, if you're someone who struggles with that part and you are just a tense individual at all times, I would check out this video right here because I go into some movements that I use for individuals just like yourself.